Peace be upon you. Today, we'll talk about immune deficiency associated with chemotherapy in cancer patients. It's well known that chemotherapy sometimes causes immune deficiency, and in some cases, with intensive chemotherapy treatments, the immune deficiency can be severe and accompanied by infections or a high fever. Now, there are a few points we need to agree on. First, there are no specific foods that boost immunity. Second, there are some precautions we need to pay attention to. First of all, we always advise patients undergoing chemotherapy sessions to avoid crowded places. If they have to be in a crowded place, they should wear a mask. It's preferable not to have close contact with someone who has an illness like a cold or a respiratory infection, so they don't catch anything, especially since their immunity is low. However, this doesn't mean the patient can't go out, enjoy themselves, visit people, or go to work, unless there are specific restrictions or the doctor advises otherwise. The most important thing in this matter is that we always tell the patient receiving chemotherapy from the moment you start treatment until you finish the last dose, and for a week, 2, or even 3 weeks afterward, if you experience a fever of 38 degrees Celsius, 100.4 degrees Fahrenheit, or higher, you must go to the emergency room. If you have a fever, meaning your temperature measured by a thermometer is 38 degrees Celsius or higher, you should go to the emergency room, preferably at the hospital where you received your chemotherapy if possible. If you have to go to another hospital, it's best if that hospital also treats cancer patients. Also, make sure to have a medical report listing the treatments you've received, so the treating physician at the other hospital can anticipate the problem you might have. This is a very important point because fever in other patients is very different from fever in chemotherapy patients with severe immune deficiency, as diagnosed by tests or blood counts. Sometimes we may admit the patient to the hospital and start giving them treatment intravenously. Now, regarding the last point, some people ask about it. There are actually injections that boost immunity. These injections stimulate the bone marrow, which is the factory that produces blood components, and they increase its activity in producing white blood cells, which are responsible for immunity. These injections have two uses. The first use is that sometimes when there is severe immune deficiency, along with a serious infection, high fever, and clear signs of severe infection, some doctors may give the patient these immune-boosting injections. Honestly, some studies have shown that these injections do not have a strong effect at this stage. The other use is preventive. Sometimes the doctor may recommend starting these injections 1 or 2 days after chemotherapy as a preventive measure. For example, they might be given for 3, 5, or 7 days, depending on what the doctor decides, as a preventive protocol. Why? Because it is expected that immunity will drop in the coming period and complications may occur as a result. The patient is given immune-boosting injections to maintain immunity. Up to this point, the attending physician decides based on the type of treatment the patient received, whether it was intensive chemotherapy or simple chemotherapy. The second factor is the nature of the patient themselves. Lastly, if the patient experienced a severe infection and high fever as a result of low immunity, this often leads the doctor to prescribe immune-boosting injections after the next chemotherapy session. This is always based on the attending physician's assessment, as chemotherapy treatment is highly individualized, especially in oncology. We encourage you to follow the channel not only to stay updated on everything new in oncology, but also in all medical specialties. Thank you.